Recording in progress. Well, I'm so excited to have you with me. I'm just not going to steal your thunder. I'm going to just bounce it right back to you to do a big introduction of you for anyone that's watching it Appear TV. Over to you.
Thanks so much for having me on today. My name's Caroline Bentley. I work for the Public Health Directorate in North Somerset Council, and my role is as a Healthy Lifestyles Service team leader. So Healthy Lifestyle Service, we've got 9 advisors, mostly part-time, 1 full-time, and we support people in North Somerset to eat well, to lose weight, to get active, and to stop smoking. And this is an initiative that's been supported directly by Peer Health. They are part funding some of those new advisors. The team has recently grown in size. And so I just wanted to really get across to anyone who's watching from Peer Health about what this service is and how we can support you as practitioners and your patients to do some of those healthy lifestyle, that wider healthy lifestyle stuff. So that's why I'm here today.
Thank you, Caroline. So let's just unpick what the job actually entails, and it's just amazing in North Somerset because there's so many initiatives in this county of ours, isn't it? So in terms of the day-to-day of what the role entails, and how it interfaces with us and how it supports our patients, how does it work? Because I want it to reach our internal team, but also, if there's any patients watching, I wanted to read them as well. How does it actually benefit both parties?
So the Healthy Lifestyle Advisors their role is actually an amalgamation of 2 roles. So within the NHS, you have the healthy weight coaches and you have the social prescribers. Well, the Healthy Lifestyle Service combines those 2 things together. So it's about some of that so we work one-on-one or in groups with clients. We support people for 12 weeks initially, and then we have some lighter touch long-term support available as well. And we know that many of us are inactive, and being active will be a support to our health, but it's not enough to just go, right, time to get down the gym or something. It's about unpicking a little bit more about why are we inactive, what's getting in the way. Maybe for some of us, we've not quite got back into the rhythm of life after being out of action for a while with lockdown and COVID. I think that's hitting a lot of people. So getting active might involve finding out a bit more about what's available locally and getting along to some of those things, like that. Yes, it's about weight management, but this, I really want to stress that I know historically talking about weight status has had a fairly negative association to it. So that's not what we do. We're very much client focused, non-judgmental approach. That's my hill to die on. Okay. So we will talk with people about, okay, what makes the difference for you? How can we make healthy eating and moving towards a healthy weight status work for you practically? So it's not about following a prescribed diet. It's about not what's wrong with you, not what's the matter with you, but what matters to you. And again with the Eat Well as well, it's about understanding some of those really small steps that sometimes we need to put in place to move towards a healthy diet as described by the NHS.
That's really good, the way you kind of break it down and unpeel it for us. Thank you. So whilst we're here then, give us some tips on some of these areas that you're working on. If there's anyone watching it and think, actually, I like what I'm hearing, how do they get to access this service? And what is it they can practically do before they actually get access to the service? Is there a waiting list? Does it take long? Is it embarrassing? How does one feel when we're going through that process of accessing the service?
Yeah, because we've got this augmented team, We don't at present have a waiting list. It's a little bit seasonal. So January, we'll have a waiting list. But at this time of day, midsummer, sorry, this time of year, midsummer, we don't actually have a waiting list at the moment. So again, we want you. Come talk to us. For practitioners within peer health, you can find the information on Remedy if you navigate to refer, adults, self-care, and then the page header is Better Health North Somerset. That will give you a rundown of the service and the eligibility criteria. For patients, if you visit the Better Health North Somerset website, you will find the homepage there. You can find out more about our service and the eligibility, and you can self-register through taking the self-assessment, the health MOT. So I'd really recommend that people go through that way, because it makes sure that people are eligible, but it also means that people can input a lot of that data about all the questions that we need to ask for monitoring, so that that's kind of all done and out of the way. And then when we meet people for the first time, we can just get cracking.
That sounds exciting. I like the fact that there's no waiting list. Thank you so much, Caroline, for coming to talking to us about this. Everyone's talking about healthy living. We all want to try our best anyway. So thank you for sparing the moment to come talk to us. And if anybody needs to reach you, can you plug the website again for us?
So please visit the Better Health North Somerset website. You'll also find us on Facebook as well.
Awesome. Thank you so much. And it's good to have you with us. Thank you.